Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Xyzal. Xyzal is the heavily promoted, newly over-the-counter second-generation antihistamine. So the first-generation antihistamines, the drugs like Benadryl or diphenhydramine or Chlor-trimeton, chlorpheniramine, those drugs are very good, but unfortunately, in at least half of the people, they get a little sleepy when they take the drug. So they're not ideal. On the other hand, we have the supposed non-sedating forms. These are drugs like Allegra, fexofenadine, Claritin or loratadine, Clarinex, desloratadine, Zyrtec, or cetirizine, and now we have Xyzal, which is Levo-cetirizine. Now Zyrtec, which is the parent compound, was granted FDA marketing approval in 1995 and went off patent over the counter. Price fell dramatically in 2007. Xyzal, the relative, also known as Levo-cetirizine, got its FDA approval for marketing as a prescription drug in 2007, and it just recently, in 2017, became marketed over the counter. Now these drugs are for allergic rhinitis. You can either have the seasonal type or the perennial type. Seasonal, obviously lasting a season, and perennial lasting the whole year, only for mild to moderate symptoms, and they work best for people who have some sneezing or some itchy or runny nose or some itchy eyes, and they work for people who have chronic idiopathic urticaria. In other words, urticaria, we can't figure out why. Originally, these drugs were marketed for people 6 years of age and above, but they did some studies and they showed they were probably pretty safe for children 6 months of age and above. Now, Xyzal doesn't seem to interfere with any other kind of drug. There's no known interactions. It's not tested in pregnancy, but it's assumed to be pretty safe. Doesn't seem to be associated with any kind of birth defects. And as far as nursing mothers are concerned, a teeny-weeny bit of the medicine comes through the breast milk. So should you use it? Well, it all depends on what kind of symptoms. Now, the side effects are more of a minor inconvenience. The most common with Xyzal, or with Zyrtec, happens to be somnolence or fatigue. They can also cause you to have sort of the blah feeling. Occasionally they cause a dry mouth. Rarely do they cause increased weight or fainting. Now, after the drug came on the market, there were some other symptoms associated with the drugs, but we don't know that it's cause and effect. But it was reported that there was some hypersensitivity and some allergic reactions and some itching and some dizziness and some tremor. Well, is it safe if you overdose? Yeah, it's pretty safe. If you're an adult and you take an overdose of the medicine up to about 200 times the maximum recommended dose, you'll just get a little bit tired. If you're a child and you do that, typically it causes some agitation or some restlessness and then some drowsiness. You can take the drug either with food or without food. Generally, you take it in the evening. The dose of the Zyrtec is 10 milligrams. The dose of the Xyzal is only 5 milligrams for adults, although some can get by with 2.5 milligrams. For children, it's 2.5 milligrams. And if you're a child between the ages of 6 months and 5 years, the dose is 1.25 milligram. Now, it works quickly, generally within about an hour, lasts for about 8-9 hours in the body. Since it's excreted mostly in the urine, if you have mild kidney disease, then you should probably reduce the dose. If you have more severe kidney disease, you not only reduce the dose, but reduce the frequency with which you take the drug. And if you have severe kidney disease, this isn't for you. You only need to take the drug once a day. It works for mild to moderate symptoms. It is not for moderate to severe symptoms. It seems to improve the sneezing, the runny nose, the nasal itch, maybe the itchy eyes. Doesn't do much for nasal congestion. That's why they make the D form that carries the decongestant. And it seems to improve hives. But it's not generally a home run. When it works a little bit. It doesn't usually get rid of all of your symptoms. Some of the symptoms are going to remain. Now, because the drug has the potential to interact with the central nervous system, you have to be a little bit careful if you're taking some other kind of medicine that might cause drowsiness, a sedative or a tranquilizer, a sleeping pill, and you have to be a little bit careful if you take some alcohol. It can also interfere with problems that require complete mental alertness and coordination, like driving. You have to be careful of this. Now, Xyzal is in the family of the second-generation non-sedating antihistamines. The problem is it can cause sedation. And of the three kinds, the three types of over-the-counter non-sedating antihistamines, the one that seems to rarely be associated with sedation, even at higher doses than recommended, is Allegra or fexofenadine. Claritin at the recommended dose doesn't seem to be associated with much somnolence or sleepiness, but certainly at a higher dose it may be. And Zyrtec at the recommended dose and Xyzal at the recommended dose may cause some sleepiness. Now, somewhere in the United States, between maybe 35 million and 40, 50 million people suffer from seasonal allergic rhinitis or hay fever. These are the people who have seasonal pollen allergies. Maybe they're allergic to grasses or trees or weeds or mold. Or some people have what we call the perennial, the year-round allergies. They have problems with the dust mites at home or the animal dander, or maybe some mold. When the drugs originally came out, all of these drugs that we're talking about, the Allegra or the Claritin or the Zyrtec or the Xyzal, when they first came out, prescription, they were about $80 to $100 a month. Well, when they came off patent and when they had generic substitutes available, the price significantly fell. Now, they seem to be preferred to the older first-generation antihistamines because the older first-generation antihistamines would cause more of a problem with drowsiness and sleepiness. They were more likely to cross the blood-brain barrier, so we don't like those drugs. They could impair your function. They interfere with learning, even if they don't cause you to be sedated. They cause problems with memory, even if you're not sedated. Problems with performance, school, at work, even if you're not sedated. So that's a major problem with the original antihistamines that the newer generation antihistamines doesn't seem to have as a problem. Well, if you wanted to take an antihistamine and you didn't want to take it orally, you could use an intranasal antihistamine, something we call Astelin or Patinase. Now, these seem to work very quickly. They seem to treat congestion much better than the oral antihistamines, and they can be combined with some of the nasal corticosteroids, medicines like Flonase. And it seems the combination actually works better than either one by itself. You could use these intranasal antihistamines, but there are some side effects. And the side effects generally are nasal discomfort. Sometimes people get nosebleed. Sometimes people get headache. The preferred therapy, if you happen to have or suffer from allergic rhinitis, whether it's mild or moderate or severe, would be an intranasal corticosteroid. They treat the itch and the sneezing and the discharge and the congestion, and they improve the ocular symptoms too, and they tend not to be associated with significant side effects, sometimes some dryness, irritation, burning, sometimes you get nosebleed, sometimes even a sore throat, and if you use them for a prolonged period every single day, well, it's possible that they can cause some mischief with the mucosa inside your nose. We also have another medicine known as Montelukast. It's not as effective as either the antihistamines or the intranasal corticosteroids. Then we have the decongestants. Everybody knows about the decongestants. Medicines like pseudoephedrine that's increasingly hard to get, or the phenylephrine that's probably just a placebo. These drugs work because they're vasoconstrictors. They only relieve the congestion. They don't help with the sneezing or the itching or the discharge. And because they stimulate the central nervous system, they can cause some problems. They can cause some difficulty sleeping. They can cause some excitability or headache or nervousness or loss of appetite or palpitations, rapid heart rate, arrhythmias, hypertension, nausea and vomiting, and even urinary retention. So then you could use the intranasal decongestant. Seem a lot safer. These are drugs like Afrin or its generic oxymetazoline. These decongestants work phenomenally well They work on congestion. They work very quickly. You could use them only for about 3 or 4 or 5 days. If you use them for a longer period of time, then they cause a rebound condition that we know as rhinitis medicamentosa. And what that is when you withdraw after 3 or 4 or 5 days, if you use them longer than that, then they cause a rebound blocking of your nose, congestion of your nose, that you have to treat with an intranasal corticosteroid, or best treated with an intranasal corticosteroid. We have some other medicines. For allergic rhinitis, we have cromolyn. Cromolyn prevents the mast cells that have the histamine in them from degranulating. You have to take them 4 times a day, and they're somewhat less effective than some of the other drugs. And then we have Atrovent, or ipratropium. This is a drug that's poorly absorbed, doesn't seem to cross the blood-brain barrier. It's nasal spray. And it's useful if your symptom is a nasal discharge. It doesn't do anything for the itching, for the sneezing, doesn't do anything for the congestion. Now, here's a very interesting story. The story goes that most medicines that we use today have 2 forms. They have the left-handed form and the right-handed form. They're what we call mirror images. We call them stereoisomers. So almost all humans use the left-handed form of the drug. So even though we take both the left and the right-handed form of the drug, the body throws out the right-handed form of the drug. It only uses the left-handed form. Now here's where the story gets interesting. Since the drugs are manufactured typically with both the left and the right forms, the drug company gets a patent on that. The patent lasts for about 10 years. They sell, they market the drug, they charge generally exorbitant prices for these drugs. And then when the patent expires, what they do is they get rid of the right-handed form and only sell the left-handed form. So let's say in the case of Xyzal, Xyzal is basically Zyrtec and just the left-handed form, not the right-handed form. So instead of taking 10 milligrams that you would of the Zyrtec, you only have to take 5 milligrams because, after all, the active ingredient of the Zyrtec was only 5 milligrams to begin with. So this new and improved stuff isn't really so new and improved. Well, what about the prices? The prices, when the drugs go off patent, when they go over the counter, and when there are multiple companies manufacturing them as generics, then they get dirt cheap. As I said, the monthly cost for the prescription agents, anywhere between $80 and $100 or a little more than $100 a month. You could buy the Zyrtec now, the name brand, for about 80 cents a pill. You could buy the generic form. You could go over to Sam's or Costco or somewhere. 3, 4, 5 cents a pill, not 80 cents a pill. Now the Xyzal, well, the Xyzal is only manufactured by the one company. We don't have generics yet. And per pill, the price for Xyzal ranges anywhere between about 30 cents and $2.50. So as John Paul Harvey used to say, you now know the rest of the story. And when I suffer from nasal allergies, well, the first thing I do is I reach for the generic Flonase. And then if I need a really quick improvement and I have congestion, then I use the generic form of Afrin. Anyway, thanks for watching. I'm Dr. Ken Landau.